Hello everyone. In this video we are going to talk about the 5 different domains of Part 3 exams for which they will assess your knowledge in their regards. So we will start with the information gathering. So the word information gathering means that you need to collect information that may help you in your diagnosis or plan of management or decision taking. Okay, so from where we gather information, mainly from the patient history, and then if still we need more information, we may gather information from further investigations and examination, or by the order, the examination will come first for sure, and then the investigations. But you may gain whatever you needed from the history, and most of the time will be sufficient. Okay, so you need to take a proper history which is relevant to your case. We have like a frame, so you have to put for yourself a specific frame so that you will not forget any of the items of the history, because very small information may help you a lot. For example, if you are taking a history for a case of amenorrhea, and sometimes you may find everything is normal and you can't know why she is not having her periods, she's not pregnant, she doesn't have any issues, and all and everything is normal, but you forgot to ask her about her job or what she's doing for living, and you discover later on that she is a fitness trainer and her BMI is like 17 or 18, like that, and that's why she is having this amenorrhea. So each information in the history will be relevant to your case you need to ask about. And that doesn't mean that you have to spend lots of time in taking the history, but you have to be smart in taking your history. So you have to formulate and modulate your questions in relation to the station, what condition you have, so what we need to know from the history. So it's different from station to station, and is not necessarily to include all the items of the history in every station, but we have certain points you will never need to miss them in any station, like the allergies, because it's a part of patient safety as well, so it carries both domains. So you have to ask about the allergies for each patient, you have to ask about the cervical screening for each patient, and so on. So some of the information we need to ask for all of the patients, but some of the information we need only to relate it to the station. And usually when you read the station, for example, you will read from the beginning, this is a simulated patient task, assessing, information gathering, communication with patient, with colleague, whatever the domains he is assessing you in the station, and he will give you the task after that. Please take a relevant history. He will not ask you to take a full history because there is no time. You have only 10 minutes, and it is not possible to take a full history and plan of management and counsel the patient in 10 minutes. So it is recommended to practice more and more, just to manage to take your history within 4 minutes, and then you will have like full 6 minutes for counseling and taking decision. But for the maximum, it should never exceed 6 minutes. Okay. So coming to the history items, first of all, we need to take the personal history. What does this mean? So before taking a history or asking the patient any question, I need to introduce myself. So how you introduce yourself in the station? You go inside. Don't be hesitant to tell hello. I am Nisreen. I'm one of the doctors here today. You can know where you are. If it is a gynae case, you can see it is in the gynae clinic or in the gynae ward or in the pre-operative ward. So you can tell, hello, I am Nisreen. I'm one of the doctors in the gynae clinic today. And may I confirm your name and age, please? Okay. Sometimes they will put the name of the patient and her age in the station, but you need again to confirm it inside, because this is one of the important information and patient safety. You are seeing the correct patient. Okay. So please confirm your name and date of birth, please, or name and the age. Usually date of birth, but because in the exam it's okay if you ask about name and age. Okay, so that's the starting to ask information, and we start with the complaint of the patient. We don't start with the history. We will start with the introduction and then how I can be of help today, or I understand, which is situation awareness. I understand that you are here today because you want to discuss about your birth options after a C-section. Is that right? So you have to know why the patient is here today. So you read the station well. You need to know why she's coming here today. And you go inside, you introduce yourself and confirm her name and date of birth. And then you tell her if there is no information telling you about why she's here today, then you need to ask her how I can help you today, how I can be of help today. But if you know why she is here, you need to be aware of the situation. Um, so I understand that you are here today because you want to replace your pessary. Is that right? Like that. So you will be aware of the situation. Then she will tell yes, that's correct. So you tell her, okay. So do you have any other like expectation or concerns from today meeting? Then she will raise any concern, or if she doesn't have any concern, then we will go ahead with the history. But how we can go ahead with the history? We will reassure her that we will address her concern, and we will discuss her why she came today in a moment. But before that, because we are seeing you for the first time, because I'm seeing you for the first time, I need to take some information about your background history. Is that okay for you? So you take her permission that we need to take a history. She will agree, okay, and then you start to go ahead with the history. So where to start from? If you are with an obstetric case, you will start with the obstetric history. If you are in a gynae case, you have to start with the gynae history. And if you are taking a history from an obstetric case, you have to start with the obstetric history and take it in full. All the items should be fulfilled. And to a limited extent, the gynae history. Because, you know, if a patient who is like 34 weeks pregnant and she's coming today to discuss any problems related to her pregnancy, what is the relevant here about bleeding in between periods before pregnancy? That is totally irrelevant. So I have to know more about her previous pregnancies, any complication during deliveries, any problems in her previous pregnancy, any problem in this pregnancy. Yeah, that is totally relevant. But if we are asking about the gynae history before her pregnancy, that doesn't relate to anything, or it will not change anything in her plan. Okay, so as I told you, so if you are taking an obstetric case history, you need to fulfill the obstetric history and minimize the gynae history. You have to ask about the gynae history, but is not in detail. And the opposite, if we are taking a history from a gynae patient, you need to take a full gynae history and a very minimal obstetric history. For example, if we are dealing with a postmenopausal lady came with prolapse, what is the relevant if I'm asking her, did you get any complication in your first pregnancy, like a preeclampsia, like GDM, or what is the relevant of that now? Okay, so I need to take the full gynae history, then I just ask her how many deliveries, was it difficult, like that, because this is relevant, but complications during pregnancies are not relevant to the prolapse. So it's like that. So where to start from is according to what case you are dealing with. So we have the obstetric history, we have the gynae history, we have the medical history. What is the medical history? Whether she is on any medication right now and like on a regular basis. For example, some patient will take medication for high blood pressure. Some patient will take medication for diabetes. Um, and sometimes if we need to ask about any medical problem, we can just ask a question, are you otherwise fit and well? That fulfill everything. Some patient will be fit and well, but she's taking some medication for anxiety. Okay, so in spite being fit and well, we need to ask her again if she's on any regular medication prescribed by her GP or no. So that is the medical history. Then the surgical history, if she had any surgeries in the past, you have to specify the surgeries to be in her tummy or from down below, because sometimes the patient may have a surgery in her eye or a surgery in her arm. It doesn't relate to our specialty, or it will not affect our plan. So when you ask her about her surgical history, you ask, do you have any history of surgeries in the past in your tummy or from down below? Okay. And then the family history, I will talk about the gynae and obstetric history in detail soon, but I'm just going through the other items of the history. So the family history sometimes may be relevant in case you have a station with a hereditary condition, like if a patient is having Marfan syndrome, for example, which is autosomal dominant. So we may see more than a member in her family with the same condition, or a patient with like thalassemia or sickle cell disease. These are autosomal recessive. Also, we need to ask about the family history. Family history is relevant, very, very relevant in case of cancer, especially if she has cancer ovary. So we need to ask about any family history of cancer ovary, cancer breast, cancer of the womb. It's also very important in in cases of VTE complications. So if the patient is having a family history of VTE, she will be also at risk. It's very important to ask about family history of heart disease, diabetes. So diabetes, in case the patient has a first degree relatives of diabetes, so that put her at risk of developing gestational diabetes if she's an obstetric case, and if she is a gynae case, in cases of PCOS, she will be prone to develop type 2 diabetes later on, you know. And she will have to screen herself annually if she has a family history of diabetes, okay, like a first degree relative. So that's very important to ask about the family history of similar conditions or family history of relevant conditions, okay. Again, the drug history and allergies. If she has any allergies, if she's taking any regular medication, not like, as I told you, sometimes the patient is fit and well, not having any medical problems like high blood pressure or high sugar or anything like that, but she's still taking some regular medication. Sometimes she will tell you, I'm on um, like ranitidine for heartburn, and she's taking it regularly. So she's fit and well, but she just takes something like in a regular basis. She's taking sertraline for anxiety. She's taking cotibine for some mental health issues. So that's another category, is not a medical history. So the medical history is the chronic conditions, but the drug history is which drug she is taking on a regular basis from the GP. Okay. The allergies is very, very, very important. Patient safety issues is to ask about the allergies. Why? If you missed this point, you will miss a very important mark in the patient safety, because it's a very, very simple procedure. If the patient is simply having latex allergy and you are going to examine her without asking about the history, and you put a latex gloves, you put the patient at risk. So it's a very simple thing. If you are prescribing an antibiotics, for example, you suspect PID and you are giving her the medication without asking about allergies, that's like unacceptable. And sometimes the patient may have allergies from unexpected things, and she will tell you, I'm allergic to nickel or I'm allergic to copper, and you are going to put for her a coil. So you need to know everything about that. Social history is very important in terms of you need to know about smoking, about alcohol, about recreational drugs, and what's about her support at home, because the social history will affect the management and the plan. You need to screen about the domestic violence, you need to screen about drug abusers and mental health issues as well. Okay. And sexual history and partner history, usually we are not touching them unless we have a subfertility case. So in subfertility case, we add these two histories. We need to talk about the sexual history, how long they have been together, if they have a regular sex, do they have any problems with the intercourse itself, any pain, any problem during the intercourse, how frequency, like that. And the partner history, we need to know more about the partner, about his BMI, about his chronic problems, about any investigation done, or any difficulty in intercourse, like that. So, and the job of the partner is very important. So these two histories, the last two histories, only in subfertility cases. Okay. Coming back to the obstetric and gynecological history. So I will start with the gynae history. Okay. So if we are dealing with a case and she is coming to the gynae clinic, we will and we did everything, we are now on the position to take the gynae history. So the first question I would like to ask is about menstruation. So the important thing in taking the history, it has to be in an open question format. So I can't ask the patient to close the questions. I can't tell her, are you getting a regular period? Yes. Are your periods taking 3 to 5 days? Yes. Do your periods having average blood amount? Yes. No, it can't be like that. You have to give the patient a chance to talk. You have to ask her, can you tell me more about your periods? Okay, and give her a chance to explain what she feels about her periods. And if you didn't gain the full information you needed, in that case, you need to ask some closed questions in between. Okay, so this is the first thing. can you tell me more about your menstruation or your cycles? Okay, and she will speak about her cycles. The second question, are you sexually active or no? Because sometimes you may ask the patient what contraception you are taking. She will tell you, I'm not sexually active, I'm not needing any contraception, and you feel embarrassed. Okay, so yeah, so menstruation, then ask her, are you sexually active at the moment? Yes. And so she is menstruating and she's sexually active, so I have to ask about the contraception. So do you use any contraception? Because it's not necessarily that she is using a contraception. Maybe she is planning for a baby, maybe her partner has vasectomy, um, maybe she's using the natural methods. So I need to ask, do you use any kind of contraception? If she told yes, what kind of contraception you are on? Okay. And tell me more about your cervical screening or the smear history. They call the screening, the cervical screening, the smears. The patient can tell, I had a smear, I did a smear, like that. Can you tell me more about your smear history? Is it up to date? Like that. Or are you up to date with your smears? Okay. Um, Be careful, don't ask these questions for a lady who is below 25 years, because the cervical screening program in UK is only starting at 25 years. If you get a patient who is 21 years old and you ask her, what about your smear history? She will look at you like that. What is that? Is it a real doctor? He doesn't know that I am just 21 and I don't have a smear yet. So yeah, so be careful while you are asking about the smear history. The patient should be above 25. So these are the normal and important things in the gynae history. You can't miss any of them. So the menstruation, are you sexually active, and what contraception you are using at the moment, and can you tell me more about your cervical smears history? And then we ask about the abnormal things. What are the abnormal things in terms of gynae? We have pain, bleeding, discharge. These are the three abnormal things we need to ask about. Pain. Pain can be in her lower tummy or in the pelvis. Do you experience any kind of pain in your tummy or in your pelvis? The pain can be either during menstruations. The pain can be either during intercourse or unrelated to both of them. So I need to ask about all of these kind of pains. I need to exclude, for example, a patient with chronic pelvic pain, of endometriosis, dyspareunia, dysmenorrhea. Okay, so again, the pain can be in your tummy. So do you experience any kind of pain in your tummy or from down below? And do you have any pain during menstruation? Do you have any pain during intercourse? And any pain in between periods? Or any pain is not related to intercourse or menstruation in your pelvis or lower part of your tummy? Okay, so this is the first item, the first abnormal item, the pain. The second abnormal item is the bleeding. So the bleeding can be just heavy periods. Okay, how heavy your periods and how long it lasts. Okay, so you screen about heavy menstrual bleeding, how heavy your periods are. Okay, and do you experience any bleeding in between periods? Do you experience any bleeding after intercourse? Okay, so the bleeding can be just a heavy period or in between the periods or just after intercourse. And the last abnormal thing is the discharge. The discharge carries the risk of infection. Of the normal infection, like we call it, is non-sexually transmitted infections, and the sexually transmitted infection. So do you experience any kind of abnormal discharge from down below? Is it smelly? Or if she told, yes, I have discharge, can you tell me more about the discharge? And if she didn't tell much information, what color is it? Is it smelly? Do you think it is abnormal? Do you have any associated itching from down below like that? Okay. And have you ever been diagnosed with a sexually transmitted infections in the past? Have you treated for it? Have you been treated for it? Okay, so that is the screening for infection. So if you fulfill all these questions, you will not miss any point in the gynae history. Again, we will repeat again. So you will ask about menstruation. Are you sexually active? What contraception you are taking? What about pain? Do you experience any kind of pain in your tummy or pelvis or from down below? This pain is during menstruation. This pain is during intercourse. Any pain is not related to menstruation or intercourse in your pelvis. The bleeding. How heavy your periods are? Do you experience any bleeding between periods? Do you experience any bleeding after intercourse? What about the discharge? Do you experience any abnormal discharge from down below? Or do you experience any like foul smelly discharge? Do you have any associated itching or anything like that? You know, if the patient told you about heavy offensive discharge, you need to screen her about the PID. So you ask her, do you usually feel hot and cold? And what about your partner? Is it your regular partner? How long you have been together? Like that. But we will keep these questions when we discuss the specific case. But this is just a general history, okay? Have you been ever diagnosed with a sexually transmitted infection in the past? And if any positive, have you ever been treated for that? Okay? So this is the full gynae history. So in any gynae case, you have to start like that. You have to take the full gynae history and then you take a small or a minimal obstetric history. But if we have a pregnant lady, how we will take the obstetric history? So first of all, we need to confirm that the current pregnancy is healthy. So can you tell me more about your pregnancy, your current pregnancy? Is everything going well so far? How about your screenings and scans in this pregnancy? How about your baby movements in this pregnancy? Yeah, and confirm confirm how many weeks she is, either by asking about her last menstrual period or just if she is documented on an early scan in early pregnancy, in the booking scan. I forgot to tell you that the last menstrual period, when was your last menstrual period, is a mandatory question for every patient, okay? Pregnant and non-pregnant. So when was your last menstrual period is a very mandatory question. So that is the current pregnancy, and then the second question will be, can you tell me more about the previous pregnancies and any complications during the previous pregnancies? What was the mode of deliveries or what was the outcomes? So it's better to ask about what was the outcome of the previous pregnancies. Why? I got one station previously states that this patient in her fifth pregnancy and she came for booking like that. So yeah, so if I asked her, how did you deliver your babies before? And she told me, no, it was just terminations. I had 4 terminations. I feel shame. Oh my God. No, you need to ask about what was the outcomes of your previous pregnancies. She will tell you, yeah, I had 2 miscarriages, I delivered 1 C-section, I delivered 1 vaginally, and like that. And then you can ask her about any problems happened during the deliveries, any complication. any history of bleeding after birth or like a PPH or anything like that, okay? So we don't need to ask much about the obstetric history. We just need to know more about the current pregnancy. We just need to more about the previous pregnancies, and that's it, okay? And it's very, very important to know the BMI of the patient and the blood group of the patient, especially because we are dealing with operations. So the BMI is very vital thing to know, and we are dealing with pregnant ladies who are at risk of blood transfusion at any point. We need to know their blood groups, and any concerns about blood transfusion should be asked in the history, because some patients may have advanced directive to reject or not to take any blood products, like Jehovah's Witness. We need to respect their wishes and not to transfuse any blood products for them. But we need to know, because we need to take other precautions in case they are anemic or at risk of bleeding. We need to counsel them well and take full written consent for that, okay? So the information gathering or the history taking is the first thing will give impression about you in the exam. You have to concentrate and practice more and more how to take a full history from the patient and to be relevant and within time. So the examiner will notice you that you are well organized, taking a full history, relevant history, asking relevant questions, and you know well what to ask in this station. So he will be, you know, the first few minutes of the station will give the examiner impression about you, how you will do the rest, okay? So please practice more and more in the information gathering, and try to manage your time. Put a timer and or a stopwatch, and try to ask your study partner, like one of the you pretend as a patient, the other one pretend as a candidate, and then you reverse the rules. This will help you a lot to just do your time well and manage the time. If further information needed and not available from the history only, we need to examine the patient. So you offer her examination, but the examination here has certain conditions to be fulfilled. Two conditions: to take a consent for the examination, and the second thing, in presence of chaperone. So how you tell her, Sarah, do you mind if I need to examine you in the presence of a chaperone? And you need to explain why you need to examine her. I just need to feel your tummy to see whether you have any tender point. And I may feel you from down below. Maybe we need a speculum examination to have a look on the neck of the womb, just to be sure about everything is fine. Is that okay for you? Like, you know, you explain to her why we need examination now. So you ask her consent, and you are and should be under no, in presence of a chaperone. So male and female doctors must have chaperone with them, okay? Is not because you are a female, for example, and this is a female patient, I don't need a chaperone. No, all the doctors need chaperone in the examination. This is for your safety and the patient's safety, because we can't guarantee what will happen. The patient can like raise a complaint that you did anything wrong with her, especially we are dealing with a very sensitive area for the woman, and she can like escalate it to the court, okay? So you need a chaperone to protect yourself, don't forget that, and patient also, she will need a chaperone to protect herself. So can I examine you, or do you mind if I examined you in the presence of a chaperone? I just need to feel your tummy. I just need to do a speculum examination. I just need to check the area of pain in the perineum. I just need to check the prolapse, whatever she's coming with, and you need to examine. Usually we need examination in all gynae cases. Obstetric cases, we usually don't need really to examine them in the antenatal clinic unless we need to know further information. Like we need to assess how big is her tummy, how like it's very uh, like minimal things. Or if I need to if she's having if she's pregnant, and if she's having a history of female genital mutilation, for example, then I need to examine her to see what degrees she is having and whether we can allow her vaginal delivery or no. So yeah, so for all gynae patients, put a rule that you need to examine them, but for obstetric patients is not a rule. Is just in relation to the station you think if we need to examine or no. If any information further needed, then the investigation will take the rule. So you may need to take some bloods to examine for, like, if you have a patient who's coming for a preconceptional counseling, for example, and she's having type 1 diabetes and she's taking insulin, and she's coming to know whether the pregnancy will be safe option for her at the moment or no. So we'll take the full history, we will examine her and do everything, but we just need to know how much is her hemoglobin A1C, because if it is above 6.5%, the pregnancy may be risky to start now. So we need to arrange a 3 months of contraception and folic acid 5 milligrams, and then regulation of her blood sugar. Then we will measure it again. Once it is less than 6.5, then we can advise her to go ahead with a pregnancy. She can plan that pregnancy now. So sometimes we need some investigations, like if you have a patient who's coming suspected PID, for sure we need to take investigations. We need to take bloods to do to see the full blood count, CRP, and to do the septic screening. Also, if we suspect pulmonary embolism, for example, we need to run some investigations like, ECG, X-ray, and CTPA, whatever, So there is a certain investigations needed in specific cases, but not in all cases. Okay, so this is how to do the information gathering in any station. I will speak about the different domains in a separate videos. So yeah, so this is for the information gathering. If you have any question or you need to ask about anything, just leave a comment down the video and I'm happy to answer at any time. Thank you.